Let's talk about how I got into one of the most competitive nursing programs without having it over a 3.5 and without doing volunteer. This is for anybody who has been out of school and wants to get back into school, maybe somebody who didn't get the best grades, or someone who's maybe a mom or a caretaker and doesn't have time to do all these extracurriculars that you would normally use to pad your resume. So just to preface this, I went to undergrad over a decade ago. All of the pre-med requirements I had done were already expired, and I did my master's in clinical psych, and that had been over 6 years ago. So again, any statistics and stuff that I would have taken had expired. I used that opportunity in order to redo all of my prerequisites, and I made sure that I aced all of them. And that is your first step, that anything you're going to take additional to supplement or to do the prerequisites, do your best in them. Take them very seriously, especially your sciences. The other thing that I did was I focused extensively on my personal statement and my interview question. And I did that by creating one solid theme for my entire application. My entire application was about advocacy and intersectionality. And I put that in my personal statement, and I used that for my interview video. And I put that in any of the things that I could possibly do it. I made a video about what my interview video was and how I was talking about the complexities of prioritizing your intersectional identities. That is an amazing topic, and you have to know like what hill you're willing to die on when it comes to a very cohesive application. If you're not going to do extracurricular activities or volunteer opportunities, you need to give a reason why, meaning that perhaps I didn't have time to do volunteer opportunities, but I was both a patient and a mother to a person with chronic illness. And that gives a different perspective when it comes to healthcare. So you want to be able to provide a holistic reason as to why you're not providing all this advocacy that you are claiming you would want to do as a nurse. The last thing you want to do is get some solid recommendations. I mean, go as high as you can go with the connections that you have. Get really good connections. I reached out to someone in my undergrad, a professor from my undergrad. I hadn't spoken to her in 14 years, but I reached out to her on LinkedIn, and she gave me an amazing recommendation. And it doesn't require you to do much other than ask. Now, have your resume prepared, have your personal statement prepared, because they need something to go off of. But if you can reach out to someone who is in a professional setting to vouch for you, then do it. I hope that it helps, and good luck getting into nursing school.